Hi, you guys. Welcome back for our daily practice questions. As always, I'd like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, flashcards, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Now, on yesterday, I went over Hep B serology, just going back over those foundational pieces to give you a knowledge perspective. Because as I stated yesterday, I see often, especially with my question and analysis sessions, that my reviewers, y'all don't feel confident in this area. You know it, but you don't feel confident, or you're getting hung up or mixing up the common two, like the surface antigen and the anti HBS, right? So we went through those foundational pieces. If you have not had a chance to look at it, go back and check that out to kind of help you tie things together. But today we'll be working through 3 questions to apply it with a full serology, okay? All right, so question number one. A 35-year-old patient presents with jaundice and fatigue. His hepatitis B serology results show an HBsAg is positive, an anti-HBs is negative, an anti-HBC is positive IgM, and the HBeAg is positive. How should the nurse practitioner diagnose? Is it A, acute hepatitis B infection, B, chronic hepatitis B infection with a low infectivity, C, a past hepatitis B infection with immunity, or D, hepatitis B vaccination response? Take a moment and tell me what you got in the comments, you guys. Now, y'all know I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you, right? So here, the stem of the question states, how should the nurse practitioner diagnose? So we know when we're looking for a diagnosis, we need to look at the assessment findings. Here, we're trying to determine what this hepatitis B serology shows us, right? So here, the HBsAg is positive, right? What did I tell y'all on yesterday? We want to look at that surface antigen and the anti-HBs, right? To determine if they have it or if they have antibodies, right? So the surface antigen is positive. So they have the infection. Now we're going to go down to the core, which is the anti-HBC. Think of the little C for core, is positive for IgM. The IgM is positive, right? Remember, IgM and IgG are the forms of core. So IgM is positive. So that lets us know that A, we have acute hepatitis B infection. The surface antigen being positive let us know they have the infection. The IgM being positive lets us know it's acute. Question number two. A 45-year-old patient has the following hepatitis B serology results. The HBsAg is negative. The anti-HBs is positive. The anti-HBC is positive IgG. How should the nurse practitioner diagnose? Is it A, acute hepatitis B infection, B, chronic hepatitis B infection, C, a past hepatitis B infection with immunity, or D, hepatitis B vaccination? And y'all, if y'all need to, pause the video so that you can walk through this and truly gauge your knowledge on this, okay? So the stem of the question here says, how should the nurse practitioner diagnose? Again, looking at the serology. So the surface antigen is negative. The anti-HBs is positive. So, okay, the surface antigen being negative lets us know that they don't currently have the infection, right? But the remembering antibodies, is positive. So they have antibodies from some form, right? For some reason, either they've been vaccinated and that's why they have immunity, or they have the chronic infection and that's why they have immunity, right? And then so the core says the IgG is positive. Remember, IgG is chronic, right? IgM is acute. So here, the best answer would be C. This would be a past Hep B infection, and this is why they have immunity, right? Because now that you know they have antibodies, because the anti-HBs is positive, we need to determine is it positive because they've been vaccinated or positive because they have had the infection in the past. This scenario, the IgG lets us know that it is a past Hep B infection with immunity, okay? And lastly, question number 3, a patient presents for routine screening and the following hepatitis B serology results are obtained. The HBsAg is positive, the anti-HBs is negative, the anti-HBc is positive for the IgG, and the HBeAg is negative. Which of the following is the most likely diagnosis? Is it A, a chronic hepatitis B infection, non-infectious phase, B, an acute hepatitis B infection, C, a past hepatitis B infection, or D, hepatitis B vaccination failure? Take a moment and tell me what you got. All right, so again, which of the following is most likely the diagnosis? So the hepatitis B, the HBsAg is positive, right? The anti-HBs is negative. So again, the surface antigen is positive, so we know they have the infection, right? And the antibodies are negative, so it's not like immunity or anything, right? So now we want to determine, is it chronic or is it acute, or what do we have going on here? So the core lets us know that the IgG is positive, so the best answer is A. This is a chronic hepatitis B infection, okay? Chronic hepatitis B infection. All right, you guys. I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one, at gmail.com. All of the things that I do offer are linked in the bio of this channel, to include my review book, the ebook and paperback option, the self-paced review course for family and adult Gero, my QBank, the flashcard, the digital flashcard option. And as always, if you're looking to book any one-on-one sessions with me, I always say either call, text, or email, because I offer a variety of one-on-one session types. So I like to speak with you first to gauge if you gauge what you truly need to make sure that you're booking the appropriate session. Okay. All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.